Hi everyone, welcome to Healthy Living Talks with Okwe. On this YouTube channel, I share health information in simple ways you can understand it, improve your health and the quality of your life. On today's episode, I will be talking about dribbling urine in men. Now, normally, urine from the kidney moves to the bladder through your ureter. And then when it is full, you have the urge, sends a signal to the brain, and then you pass out your urine through your urethra and your penis. So what you now have is that sometimes you milk out, you shake off, thinking that the urine has ended, and then maybe a minute later, you just notice that there's a drip of urine, which can be sometimes embarrassing. That is what we call dribbling. You can have it maybe when you cough, when you laugh, when you strain, maybe you lifted something heavily. But when it becomes a pattern, these are the things you need to know. Then in my practice as a licensed pharmacist, I've heard people market it that, oh, if you're having it, it's an infection. Sometimes true, sometimes not. This is because sometimes gonorrhea, a type of sexually transmitted infection, makes it difficult to urinate. So people assume that if every other person is having dribbling in urine, then it's an infection. No. There are different causes why you can have dribbling in men, dribbling urine in men. The first thing is disease. So you can have some disease states that can make men dribble urine. On the top of the list is prostate, whether it's benign or cancerous. So that can, when you have an enlarged prostate, urine can dribble. The other thing is other diseases such as diabetes, stroke, multiple sclerosis. They can make a man dribble urine, and not just because he has an infection. The other thing to know is that lifestyle, old age can make some men dribble urine, obesity, lack of exercise. If the person has just undergone a surgery that may have affected his bladder, can make the person dribble urine. There are side effects of some drugs also, such as antidepressants, diuretics, some sedatives that can make a person dribble urine. So not just because, oh, the person has long-term infection, like they usually say. And finally, another thing can make a person dribble urine is when there is like structural damage, whether the bladder is having an infection, whether there's an injury or a damage to any of the parts at which urine will come across. So from the kidney to the ureter, through the blood to the bladder, and then to the ureter. If any of this urinary tract system, any of the organs have issues, or any of the tissues have issues, then it can make a man dribble urine. Sometimes nerve damage also can make some people dribble urine. So if as a man you're dribbling urine, it's important to speak to your physician. Or if you're having weak stream of urine, or you think that urine is not, you're not voiding out urine completely, you're still feeling as if you're pressed, then it's a good time to speak to your physician. There are a number of things that you can do to help improve it, but it's important to speak to your physician first. Kegel exercise for men, that is trying to urinate as much as you can and then hold it, pause, and then continue, can help. Avoid excessive intake of alcohol, maintain a healthy weight and a healthy diet are other things that can help you avoid dribbling of urine. I trust this information has been helpful. If you want a one-on-one medication consultation on any of your medication, please click the link in the description box below and I'll be reaching across to you. Till I see you again, remember Google is your friend, but I am your professional. Cheers!